Good afternoon, everyone. My name is Mags Rogers. I'm the Executive Director with the Neurological Alliance of Ireland. And I'm here this afternoon to talk to you all about the need for a consultant neurologist for Wexford Hospital. The Neurological Alliance of Ireland is the national umbrella for over 30 neurological charities working with people with neurological conditions. And our 2024 Patients Deserve Better campaign in association with Roche Ireland is calling for consultant neurology services for 5 regional hospitals across Ireland, including Wexford Hospital. What we have at the moment across many parts of Ireland is effectively a postcode lottery, where people have to travel extremely long distances frequently to see their neurologist when they could be seen more easily and more quickly in a local hospital. You'll hear this afternoon how that is the case in Wexford Hospital, where patients throughout Wexford and South Wicklow are making frequent long journeys to hospitals in Waterford or even in some cases to Dublin hospitals to see their neurologist. I'm delighted to be joined by our 2 speakers this afternoon, Dr. Orla Toohey from University Hospital Waterford, and also from Lorna Whitty, who is chair of our local MS group and an experienced advocate for neurology services throughout Wexford. She's living in the Wexford area and has that experience of travelling long journeys to see a consultant neurologist. So without further ado, I'm going to hand over to our first speaker, Dr. Orla Toohey, but just briefly to welcome all the attendees this afternoon and just to invite people to put any questions or comments they have using the Q&A or the chat function at the bottom of your screens. So I'll just hand over to you, Dr. Toohey.
Thanks very much, and thanks, Mags, and to the team for the invitation to speak. And I suppose I would advocate that there is a great need for a consultant neurologist in Wexford. My name is Orla Toohey. I'm a consultant neurologist in University Hospital Waterford. So my job as a neurologist is to diagnose and to manage patients with neurological conditions. We see patients with a wide variety of conditions, some of which are acute, some of which are chronic and require long-term management and long-term supports. There is, a degree of health inequity in that Wexford General does not have access to a consultant neurologist at the moment. Why it's important to have a neurology presence in the hospital is that a significant proportion of acute medical admissions are with a primary neurological condition. And currently, if you are admitted to Wexford with just a condition, you don't get to see a neurologist. It's been shown, and there's data from the UK and elsewhere that shows that actually being seen by a neurologist, if your primary reason for presentation is a neurological condition, that it improves diagnostic accuracy. It can alter management or the treatment that you're given, and it also reduces length of stay. So there's both patient centres and health economic reasons why having a neurology presence in a hospital is important. I suppose the other route through which we see patients is in the outpatient clinic. So a large proportion of our work is with seeing patients for follow-up, seeing them for the first time and diagnosing them with the neurological conditions. Examples are epilepsy, multiple sclerosis and Parkinson's disease. And patients with these conditions require, a diagnosis, they require support, and they also require management over a longer time frame. My subspecialty area is multiple sclerosis. It's an exciting area to work in. It's a relatively common condition in Ireland, tends to afflict people early on in life at times when they're in the productive phase of their life through work, employment, family life, etc. Early diagnosis is key to management because we do have access to effective treatments that can control the condition and can prevent patients developing disability further down the line. So early access to being able to see a neurologist, having clinics that are local to you for follow-up, particularly when people might be on treatments that require them to attend hospital, for example, once every 4 weeks, having to travel, get in a car and travel an hour to a hospital remote from where you live, and having to do that, for example, every 4 weeks is quite onerous. and might affect, important aspects of medical care, such as patients' adherence to treatment, and also has a ripple effect on disrupting their day-to-day life. It might affect their employment, their work schedule, their family life, particularly if they need to factor in childcare, travel costs, and all those other things that we don't necessarily quantify when we're thinking about treatment. So equal access to resources, to clinical expertise, and to treatments is something that we need to advocate for, particularly in regions such as Wexford, where the journey to Waterford or the journey to Dublin for treatment just isn't fair to expect someone to be able to do. We have data there to know that, outcomes for patients who are adherent to their treatment, who are under regular follow-up and have the necessary support and management team in place are better. And that's why I'm very much behind this campaign that the NAI are running. I think we're going to hear from Lorna next, and I think that's, behind every number, every figure of patients that aren't seen, there is a person, and that person could be any of us, our family, friends, or relatives. So I think that's justification enough for advocating for this next position.
Thank you so much, Dr. Toohey, for that. And before I pass on to Lorna, I might just comment, just in relation to that postcode lottery that we're seeing, in different parts of the country, what we're seeing is that some areas have access, some hospitals have access to a consultant neurologist and some don't. And it really is, as I say, there's very little rhyme or reason to it. It's a historical thing. So, for example, Wexford doesn't have access to neurology services. Smaller hospitals like St. Luke's and Kilkenny do. Again, an example from the last campaign launch that we held, Portlaoise Hospital doesn't have neurology services. Tullamore Hospital down the road does. So it is effectively that unfair, that postcode lottery for patients, that just because it's their local hospital and traditionally wouldn't have had a consultant neurology service, whereas there are similarly sized hospitals around the country that do. And according to the model of care, the 2016 model of care for neurology services in Ireland, all Model 3 hospitals like Wexford should have a dedicated neurology service. And as they just, all the points that you've made this morning, Dr. Toohey, about the disruption to patients' lives, that you're looking at people every 4 weeks having to make those long journeys to see their neurologist when it could be provided more easily and quickly in their local hospital. But also, I suppose, to remember from the perspective of local GPs, from the perspective of staff working in Wexford Hospital, that they don't have access, quick and easy access to that neurological expertise as well. So there's a myriad of reasons why we would be calling for a neurology service for Wexford Hospital, in line with the plans, in line with the model of care for neurology services. And just briefly, I just want to thank Senator Malcolm Byrne and Deputy Stephen Matthews for joining us. I see them in the list of attendees this morning. We really welcome their time this morning to listen to this conversation. I might pass over now to Lorna to talk about her own experiences, as you say, living as a person living with MS in that catchment area of Wexford Hospital.
Hi, everybody. Sorry. Hi, everyone. My name is Lorna Whitty. I am living in Killinick, so it's the South County of Wexford. I'm married with 2 grown-up children. I've been living with MS for 20 years, diagnosed in that about 10 years ago, whereby I was hit one day with optic neuritis. For those that don't know, it's when the nerve endings on your eye, your optic nerve, strip back. So I couldn't see properly out of my eye. I thought I had a lazy eye, to be honest with you, and that the eye would wake up as the day went on. That didn't happen. So I was 5 days in a row, 6 days, sorry, in a row, going to Waterford Regional for them to try and diagnose what was wrong with me. And that was about 150 kilometers a day for 6 days in a row, where we didn't have a choice but to travel to Waterford because we don't have the services in Wexford. That necessitated my husband having to take a day off work each time. And each time I do have an appointment in Waterford because I suffer from multiple sclerosis. I don't know what I'm going to wake up on any given day. Because the original optic neuritis affected my eyesight, I wasn't given timely treatment. So there is damage there to the optic nerve, or the disc at the back of it that hasn't healed and won't heal. So I can't tell you today if I'll be able to see properly to drive. So every day is like wake up and see. It's nearly like the weather in Ireland. It changes. My condition changes so much during the day. I could be able to see fine now, but in a few hours' time, my eyesight might go blurry. I might be able to see double from my eye. Not alone that, I suffer from severe multiple sclerosis fatigue. So by the time I'd get to the appointment, find parking, see the neurologist, then try and drive back, I wouldn't myself be trusted to drive the car, because I would actually be so tired at that stage to be able to drive. Whereas if it was Wexford, there'd be absolutely no problem whatsoever. It's literally a 15-minute journey for me, 12 kilometers actually it is in, and 12 back out, so 24 kilometers. And there's plenty of parking there. There's no issue about driving around for ages, looking for parking, stressing yourself. I've had 9 a.m. appointments in Waterford Regional. We left here at, actually it was 6:45 that morning, and I arrived at the appointment bang on at 9, and it was purely down to traffic. But in that time, I was so stressed. By the time I reached the appointment, everything I wanted to ask or say had gone out the window, because all I could think of was getting there for this appointment, and we couldn't go any faster, but we did arrive bang on 9. But that was a 2-hour, 15-minute journey, which should have been about an hour journey normally. Other times we take the ferry, but when you're taking the ferry, you're adding to your costs again. Bad roads as well. So we prefer the main road because it's more direct. But each time you have to allow not alone your journey, but then if you're stopped, because the journey is long, you may be stopping for a cup of tea, a scone, a sandwich, whatever. So it's all adding to costs. Then you have patients that aren't as mobile as myself, how they can get up and down to these appointments if they can't get on public transport. They have to get a taxi down. I have friends whose father suffers from Parkinson's. They have to take unpaid leave every time their father has to attend Waterford. Either herself or her brother take unpaid leave to go down to Waterford. Whereas and that's a day gone. Whereas if it was Wexford, it'd be only an hour or two, and they can be back in work. Like, so there's an awful lot to be said for having a neurologist, not alone for multiple sclerosis, but even like a stroke victim. I spoke to one there a few months ago who had to wait on a private ambulance to come to Wexford, because there's no ambulances in Wexford, to take him to Waterford. And the delays are unacceptable because, as Dr. Toohey has stated, early intervention, is essential in neurological cases. So it's a no-brainer. We need a neurologist in Wexford. I could talk for all of Ireland on this, but I'm going to be wary of time and hand back over to Mags. I think I've spoke for long enough now. Thank you.
Thank you so much, Lorna. And not at all, you've made really, really important points this afternoon on the impact on you, but also, the people that you've spoken to, people living with neurological conditions in the Wexford area, that it has such an impact. And as you say, this is something that your local hospital is so near to you. It would save so much time, stress, if you had a local neurology service available to you. And I suppose just to say that what we're calling for in the Neurological Alliance of Ireland with this 2024 Patients Deserve Better campaign, we're calling for something that's already policy, that's already published government policy in the 2016 National Model of Care for Neurology Services, that there would be a dedicated neurology service in all Model 3 hospitals the size of Wexford around the country. It is available in a lot of our regional hospitals, and unfortunately, hospitals like Wexford Hospital and 4 other hospitals that we've identified in our 2024 campaign are unfortunately outliers. We've seen proposals developed, proposals on the table, but not followed through. So it really is essential that this policy is followed through this year, and that people living in the catchment area of those 5 regional hospitals, Wexford hospitals, but also including our other hospitals in Bantry, Mayo, Letterkenny, Portlaoise, would also have their promised neurology service available to them. As I say, I thank the audience who've joined us in the webinar this afternoon for their time. I'd like to thank the elected representatives. I know Deputy Matthews and Senator Malcolm Byrne have joined us, but also I know that there are representatives from the offices of other of our elected representatives joining us this afternoon. I'm very conscious they've had a very busy weekend at counting centres, many of them. So I would like to thank them for their attendance and the attendance of their representatives. I want to thank Dr. Orla Toohey, consultant neurologist with University Hospital Waterford, for making that clinical case for the necessity for neurology services for Wexford Hospital, and also to Lorna, who's told us about her own experience and the experience of so many people living with MS and other neurological conditions throughout Wexford, who are in a similar position to herself of needlessly having to travel long distances for neurology services. We will be leading this Patients Deserve Better campaign right up to budgets this year, calling for a consultant neurologist for Wexford and the other regional hospitals. If people haven't done so already, I'd ask them to visit the campaign website, patientsdeservebetter.ie, and you can visit that website and very easily and quickly contact your local TDs and request their support. And thank you all. Thank you especially to our speakers and also to our audience this afternoon for their support. Thank you. Right, I'm finished up at this stage. Thank you, Dr. Toohey. Thank you, Lorna.
No
Thanks,
problem.
Max. Thanks,
Thanks
Lorna.
million.
Bye-bye.
Thanks,
Thank you.
Lorna. Thanks, Max.